Hello, welcome to InfoHub. Here is what you need to know for today, Tuesday, July 10, 2018. Government assures Barbicians that there will be no increases to the Berbice Bridge tolls. The push is on for more citizens to vote in local government elections. Saudi Hospital continues to improve services. The ICT Roadshow showcases how digital technology can change how businesses operate, and youth-friendly spaces to be established countrywide. And now for the details. We start this evening with a solid reassurance from the government that there will be no increases to the Berbice Bridge toll. In a press conference this morning, Chairman of the Berbice Bridge Company, Dr. Surendra Prasad, called for significant increases to the tolls. But in a statement this afternoon, the Ministry of Public Infrastructure said that government is contemplating no increases and stands by its decision to reduce tolls in fulfilling a campaign commitment. See the full statement by the ministry on our website, www.dpi.gov.gy. Now let's turn our attention to news from other sectors. First Lady Mrs. Sandra Granger yesterday launched another Information Communication Technology ICT Youth Training Program, this time in the Essequibo Islands West Demerara region, Region 3. The program aims to provide skills in the areas of information technology, literacy and numeracy, entrepreneurship, sexual reproductive health, STEM subjects, and other soft skills. The First Lady congratulated the participants for making the decision to be a part of the program. She also expressed her gratitude to the Ministry of Social Protection and the BIT for their continued support. The program is a collaborative effort between the Office of the First Lady, the Ministry of Social Protection, and the Board of Industrial Training, BIT, will run for 4 weeks and cater for 30 participants. Training sessions are conducted at the Leonora Secondary School, West Bank, Demerara. Minister of Communities Ronald Bulkan says government is seeking to ensure more Guyanese vote at the upcoming local government elections. Here are the details.
The second round of local government elections under the APNU-AFC government will be held in November. Minister of Communities Ronald Bulkan told InfoHub that all efforts will be made to improve voter participation at this year's polls.
One of the major focus of the ministry is to ensure that there's a higher level of participation at these elections.
After more than 2 decades hiatus, local democracy was returned in 2016 with the hosting of local government elections. Minister Bulkan cited the figure for that election as 43%. Government's public education and information campaign is geared at increasing this amount.
To ensure that, at a minimum, the overall turnout to be greater than 50%, but that at the level of our constituencies, that we even have a greater turnout than 50%, because it is only then that we can be reasonably satisfied that a greater number of our citizens understand the importance of local government.
Among government's plan of action is public education on local democracy. Minister Bulkan reminded that Guyanese must understand the importance of governing their own communities. Crystal Stahl for InfoHub.
The Caribbean Telecommunications Union Information and Communication Technology Roadshow continued today with a workshop on how digital technology can change the business landscape. Here is Stacey Carmichael.
The Digital Financial Services Workshop focused on the benefits and challenges of using cryptocurrencies and mobile money. A cryptocurrency is a digital or virtual currency that uses encryption for security. Supporters of cryptocurrencies said they are difficult to counterfeit because of this security feature. Co-founder of BIT Barbados, Oliver Gale, said the notion that the use of these virtual currencies poses threats associated with money laundering is far-fetched. He focused on how the use of virtual dollars can revolutionize the way business is done in the Caribbean, urging buy-in by central banks.
It's a much better form of currency. It can be transferred across borders instantly, it can be stored at low cost, it can be created at low cost. And so what we are doing is taking this blockchain technology, working with central banks such as the Eastern Caribbean Central Bank, to create a digital fiat currency, which is controlled by the central bank as the issuer, but inherits these properties of mobile or digital money, and inherits the properties of the blockchain. And what this allows is for a mobile money ecosystem to be created.
Head of Legal and Regulatory Risk Financial Services Digital, Diana Sterila, said among many other advantages, studies have shown that it is 20% lower to make digital payments or to use mobile money.
Some studies are also showing that there is an added security when you do digital payments and mobile payments as opposed to cash. That is quite self-explanatory when you're walking around with a bundle of cash and when you have that digitized in your mobile wallet. There's a big difference between the two.
Both presenters said a major challenge to using mobile money and cryptocurrencies is that of overregulation. They believe that for the Caribbean to move fully into the 21st century, policymakers must begin the conversation on the benefits of these new technologies. The CTU Roadshow hits Anai, Upper Takatu, Upper Essequibo, Region 9 on Wednesday. From the Arthur Chung Conference Center with videographer Akeem Thomas, Stacey Carmichael for InfoHub.
Thanks for staying with us. As there continues to be debate around the availability of drugs, Minister of Public Health Valdo Lawrence is adamant that there are adequate supplies. In this regard, patients who are told otherwise by healthcare officials are encouraged to call and report their experiences so that she can ensure they are addressed directly. Here's that report.
Certainly, it's 226-1818. Or call me, 608-4001.
Minister Lawrence said there are established systems in place to investigate claims of unavailable medication at health centers and other medical facilities.
Whenever we get a complaint, we investigate immediately. And not only investigate that the person was told that there is no drug or medical supply, but we also investigate internally to see whether request was made and where is that request, or when was the last time they were supplied.
The public health minister added that impromptu visits and other methods will be used constantly to monitor what happens at medical facilities across the country. Remember, the numbers to call are 226-1818 or 608-4001. For InfoHub, Delicia Haynes.
And staying with the health sector, the Saudi Hospital is the main medical facility on the Essequibo coast, and it continues to improve the delivery of healthcare to thousands of residents. Delicia Haynes was there and filed this report.
Despite challenges, the Saudi Regional Hospital in Pomeroon, Supanam, has tended to thousands of patients. At a recently held Regional Health Officers Workshop, Acting Regional Health Officer Dr. Afara Khan said that there were notable increases in persons accessing health services within the region for 2017.
Number of inpatients for 2017 is 4,013, outpatients 21,128, accident and emergency 7,515. Number of persons seen in the special clinic is 7,269, and our referrals to Georgetown increased a little bit to 177 in 2017 as 272 in 2016.
The increased referrals to Georgetown Hospital, Dr. Khan noted, were as a result of minor shortcomings within the region's healthcare system. There is a planned modernization project for the Saudi Regional Hospital, which will see a reduction and eventual elimination of most referrals. Meanwhile, the region's district hospital underwent upgrades to offer healthcare on a more community-based level.
The number of referrals to Saudi Hospital, 972. Now, this increase in the referral during this period was because Oscar Joseph District Hospital was under rehabilitation. So the wards were out, and so most of the critical patients and those patients we had to to Saudi.
The modernization will come on stream after consultations for a new hospital facilities construction. With this, persons will be able to access a wider range of health services in a timely manner under the best conditions within the region. For InfoHub, Delicia Haynes.
Thank you, Delicia. The Public Accounts Committee has commended the Regional Executive Officer, Pauline Lucas, and her team for responses to the Auditor General's 2016 report. Stefan Gabriel has more.
Minister Lawrence commended REO Pauline Lucas for her presentation and the manner in which she answered the questions of the Public Accounts Committee. She also had recommendations for Permanent Secretary of the Ministry of Communities, Emil Magarel.
I wish that in future to the PS, he can probably bring some of the other REOs and let them sit in the gallery you know, so that they can be able to get a feel and a sense of how they should be preparing to come before Public Accounts Committee with their information and also the manner in which they respond to the questions proffered to them. So congratulations to you and your team.
Meanwhile, the REO Pauline Lucas says all contracted workers below the age of 45 are now on the fixed pensionable establishment. She added that the Attorney General's chambers and SARA have been approached for the assistance to recover government buildings in the region and police to continue to investigate the issuance of fuel to 2 unauthorized vehicles on the region's account.
With effect from September 2017, all of the fuel that was paid for sometime in September 2014 was consumed by the region. We now pay as need be. So we pay on a monthly basis to Guyana for the fuel.
The Public Accounts Committee is a parliamentary standing committee with responsibility for examining how departments of state expend budgeted funds. Particular attention is paid to matters identified by the Auditor General's report. For InfoHub, Stefan Gabriel.
A number of youth-friendly spaces across the country are being resuscitated or established to provide young people with safe spaces to deal with social issues affecting them. Isaiah Braffett has more.
This was disclosed by Youth Director Melissa Carmichael Haynes, who said that social issues troubling young people must be addressed head-on.
The Youth Department has taken on board to look at the resuscitation of youth-friendly spaces in a number of regions, so that young people will be able to have a safe space. They'll be able to have open conversations. They'll feel free to discuss with the facilitators there on these issues. So efforts are on board and efforts are in place to ensure that social issues development is a priority for our young people.
Youth-friendly spaces will be resuscitated in Regions 10 and 4, while new ones will be established in Regions 1, 2, 7, 8, and 9. Carmichael Haynes noted that there are already youth-friendly spaces in Regions 3, 5, 6, and Western Veldt, where young people are being engaged.
Those youth-friendly spaces have been having sessions in those areas. The youth officers, the social workers as well, they also have been working with schools and communities, the RDCs, the NDCs, to put together afternoon programs, edutainment sessions, crime prevention workshop, good governance sessions, so that young people can be engaged.
The development of youth-friendly spaces, the youth director explained, is in keeping with the theme for International Youth Day 2018, Safe Spaces for Youth, observed on August 12. Isaiah Braffett for InfoHub.
And in our final report, Guyana's High Commissioner to India, David Pollard, was recently accredited to Bangladesh. He presented his letter of credence to Bangladeshi President Mohammed Abdul Hamid. High Commissioner Pollard is based in New Delhi, India, and is also accredited to Indonesia and Sri Lanka. Here now are your bridge and weather reports. Today, France marched into the World Cup final with a 1-0 win over Belgium. Tomorrow, England will play Croatia to determine the other finalist. Goodbye.